of seeing doctor after doctor after doctor without finding a solution to your symptoms? Stop the suffering. Our next guest says if you want to get your life back, start with the underlying cause of your symptoms. It's kind of like the overriding theme of today's show. Welcome back the founder and CEO of Hotze Health and Wellness Center, Dr. Stephen Hotze, along with his patient, Andrea Oliver. Good morning.
Thank you, Deborah. Good to see you.
All right, so Andrea, you had symptoms that actually started in your early 20s that you would think someone in their early 20s should not be dealing with.
Right.
Things like what?
Memory loss, hypothyroidism. Well, it turned out it was hypothyroidism.
Yeah, we didn't know that at the time. Yeah.
No, I had gastrointestinal issues, gas, bloating, diarrhea, constipation.
So something's obviously wrong.
Couldn't find a doctor that could help me.
Yeah, they put you on antibiotics, or they say maybe you need an antidepressant or something like that, right? And Dr. Hotze, as we've said all along, trying to medicate away or the symptoms, but not deal with the actual issue. There was I always say nothing by accident, but a coincidental meeting in the mall one day. You're working at a kiosk in the mall, and what happened?
I was just working. It was a normal day, and this charming, handsome man walked in and shook my hand.
That was a long time ago.
So he shook my hand, and as charming as he is, he noticed that my hands were cold and swollen, and asked me about it.
Yeah, what did that signal to you, Dr. Hotze?
That she was low in thyroid.
Yeah, well, you know that, but so many doctors misdiagnose this, or again, as we've been talking about, may treat a symptom.
Or don't diagnose it. It just goes undiagnosed.
Yeah, yeah. All right. So
I was going by because I had lost my watch, and I said I got to run and I get a watch, and there was this kiosk right there. I said, "Give me a watch. What do you got?" And she had a Seiko watch, and we started talking and visiting with her, and I told her about her hands, and then I think I gave you my card, probably.
You asked me for my home address and my telephone numbers. We didn't have cell phones and emails at that time. So I gave him my information, and I couldn't believe I had done that.
But you know what? But when somebody comes up to you and says, you know what, your hands are cold and swollen.
I sent you a book, I think, didn't I?
You did. And he did say the ladies in his office would send me information, which they did. I received it in about a week. And it just so happens I had a friend over, and he said, is that the doctor you gave your information to? My parents have known him for years. He's a great guy. So
there you go.
I knew it was divine intervention.
But when you saw the book and started reading stuff, did you kind of like the light went on and went, that's me?
Sadly, yes. Yes. You know, it was great to find somebody who knew what was wrong and could give me the answers I needed and tell me what to do. Yeah. And I immediately started treatment. I actually had to do the treatment quite a bit longer because I was so sick at the time, but no one else could have helped me, and I've been there for almost 20 years, and I'm just so thankful.
Yeah, life is so different than it was back then. All right, Dr. Hotze, you know, and I see that even 20 years later, the relief in your eyes, because I went through the same story, and I kept saying, what is wrong with me?
Right.
And I had all kinds of things said to me. One of them was, you're old and had a baby. Like, okay, what? Right? But, you know, and then the cloud lifted when it was like, it's hypothyroidism. Right. Now, Dr. Hotze, the problem for a lot of people, I've run into lots of folks who said, hey, I saw your show, I went and got tested, but they said that my
blood tests were normal.
Yeah, they were normal. I'm within the range.
Has anybody out there ever gone to the doctor and thought you might have low thyroid, and he told you your blood test was normal? Raise your hand if they've done that. So you knew you had it, but he didn't recognize it because your blood test was normal. Well, let me just tell you what. Blood tests are not the be-all, end-all of diagnosis. All blood tests come back normal 95% of the time because that's what they define as normal. Wherever 95% of the people's blood tests fall, from this high range to a low range, as long as they're within this large range, it's called normal. So you may have been up here at an optimal range when you were younger. Thyroid, of course, gives you energy, right? A thyroid enables your body to have a metabolic rate and to run. And if your thyroid levels fall, even in the normal range, then if it's down 50%, well, your energy level is going to be down 50%. So you have to, it's not whether or not you're in this large range of normal, but whether or not you have symptoms and you're at an optimal level. So thyroid can be supplemented. And I frankly can't remember if you showed low thyroid in your blood test or not, but Andrea had symptoms of hypothyroidism. And in view of her symptoms and everything else we looked at, we said we'll give her a therapeutic trial of some thyroid, natural thyroid, and we did. As it turns out, that helped resolve the problem. But she also had been, some doctor had been treating her for antibiotics for some lower abdominal pain for a year. And, of course, what does that lead to, ladies? You take antibiotics, yeast overgrowth. Yeah. So she's having all kind of gastrointestinal problems. Had to get her on a yeast treatment program as well.
And today you are?
Great. I feel better than I ever have.
So here's the moral of the story. If you're working at a kiosk in the mall and you see Dr. Hotze come up to you, you shake his hand.
And give him the number, too. Give me the number.
That's right.
Now, let me just mention this. At our center, one question we often have is, do you take insurance? And let me say we don't, and I never have accepted insurance. Let me tell you why. Because insurance companies tell you how to treat patients. They have a certain plan. If you don't follow their plan, they won't pay you, and they do not support natural approaches to health. That's just not how they do it. Now, we always give our guests a receipt they can take, and sometimes the insurance will pay for it. But you really got to decide if you want to invest in your health, and that's what Andrea did, even as a young age, and it paid off.
Best investment I made.
Now she's married, got 2 kids, and doing great.
All right. Well, Dr. Hotze has written 2 books about hormones and hypothyroidism. Visit hotzehwc.com/GDH to get your free copies today. All you have to do is pay for shipping, and everyone in today's studio audience is going home with a copy of Hypothyroidism, Health, and Happiness. You can also join Dr. Hotze March 24th through the 26th for Energy for Life, an online series with health, nutrition, and detox experts to find out how you can get your energy back. The event is free, but you must register. To do so, visit hotzehwc.com/energy. And he also does a number of events, speaking engagements that are very educational as well. And for more information on Hotze Health and Wellness Center and to make an appointment, call 888-473-5531, 888-473-5531. Are you